You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the modern facelift, how to look years younger with or without surgery. With us, we have Philly's go-to facial plastic surgeon when you want natural results, Dr. Greco. Dr. Greco, welcome to the program.
It's a pleasure to be here, Randy.
All right, now you brought a lot of photos, so we'll try to get to most of them.
Okay.
For people that don't know you, tell us a little bit about your practice. Who's your typical patient? I guess you're board certified facial plastic surgeon, also otolaryngology. So who is your typical patient?
I really don't have a typical patient, Randy. Patients come to me because they want to look and feel better about themselves.
Okay.
And this may involve something as simple as an injectable to remove some lines between their eyes, or it may actually be a procedure like a facelift to help to restore a more youthful, fresher looking patient.
Now, are the patients for facial plastic surgery, are they getting older and older or younger and younger? Because it's become more mainstream, is that correct?
Yes, it's actually growing in both directions. I think that we have become a society that really puts a lot of emphasis on our appearance. And I'm not saying that in an arrogant way. I think this improvement in appearance is what builds self-esteem, gives people that confidence that they want, and they feel like they can put their best foot forward, whether it's going to their job or going on a date or whatever. And I think that's where the interest is in patients looking as good as they can.
Now, you believe you're changing people's or transforming people's lives.
I do, Randy, and I'll tell you why. Patients tell me that.
Okay.
They tell me that after their procedure, they tell me what kind of effect the procedure has had on them. And I can tell as soon as they walk into the office for their 3-month follow-up, I can tell by just their gait or how they walk. It's almost like there's a little cloud underneath them. They just feel so much better about themselves. And let me show you.
All right.
Here's a woman that came to me. She had an event coming up, okay? This woman had her daughter getting married. And, as that's a big event for a family. And really what she wanted to do was she wanted to just look fresher and rested and better. So let me tell you about her concerns, Randy. She's actually an attractive woman that the signs of aging are just starting to work their way into her face. First of all, Randy, this is a patient I love to see in my practice because I know when I see a patient like this that I can really help them. Just from 20 years of experience and seeing the patients that come in for aging face surgery, this is a patient that I'm getting excited about.
Okay, all right.
And I'll tell you why. First of all, let's look at the upper eyelids.
Yeah, tell me when you look at a face like this, what are you looking at and what are you planning on doing?
Yeah, I try to go from head to tail, and I'll always have a patient have a mirror in front of them. And I'll talk to them, but I'll have them look in the mirror so they understand where I'm coming from, okay? So with this particular patient, we looked at her eyes, and she noticed the heaviness of the eyes. That was something that was quite evident to her. The other thing that she noticed that she had some puffiness underneath her eyes. As we move down the face, Randy, the nasolabial folds here, this really bothers patients. And it is probably one of the most common reasons why patients come in, even at a younger age. This is an area that bothers them. The thing that bothered this patient the most was the jawline or the lack of it. And that's what happens when you develop jowls. You lose that crispness of the jawline and then the laxity of the neck. Now, what I'm going to show you right now is I'm going to show you her after picture.
So what did you do for her, by the way?
Let me tell you what we did for this particular patient, Randy. First of all, we did her upper eyelids. And her upper eyelids involved placing an incision in a natural lid crease of the upper eyelid. And what we did is remove the excess skin and fat of the upper eyelid. But one thing I want to mention about upper eyelid surgery, Randy, is that it's a delicate operation. You don't want to take too much of the soft tissue of the upper eyelid away, or you can create this skeletonized or cadaveric look. And that makes the patient look very unnatural. you want to take enough away so that you create a platform. So what's the platform? Something every woman loves. It's the distance between the lashes and the lid crease. That's important because that's where they can apply their makeup. In fact, how many times have I had a woman come to me and say, I am so sick and tired of having to lift my brow up in order to get my makeup on, because they actually have to lift their upper eyelid up. So that's what we're trying to accomplish with upper eyelid surgery. When you look at the eyes, Randy, the eyes are viewed as a continuum. So when patients come in and they have heaviness and puffiness of their upper eyelids, it really helps many times to try to enhance the lower eyelids also, because everybody views the eyes as a continuum. And for her, we also went inside the eyelid with what we call a transconjunctival approach. And we removed puffiness, and then we also tightened the skin. So that helped her upper third of her face for rejuvenation. As we moved down the face, these two lines here were something that really bothered her and were relatively deep.
But what about like facial fillers in that area for her?
Facial fillers are a good option.
Because you're a big filler guy, right?
Yes.
Adding
yes.
fat, their own fat as well.
Absolutely.
Why not just do that to her?
In fact, that's what I did with this patient, was add her own fat.
All right.
So I like to use fillers sometimes in patients like this, Randy, as a rehearsal, meaning that if they're not quite ready to have the procedure done, I think sometimes the rehearsal can be a little bit of a tickler for the patient. It gives them the opportunity to see the results. But this kind of patient doesn't, with structural fat grafting, the result is longer lasting, and I think fits the procedure that she's having done better. I mean, she could have also, proceeded with some sort of filler if she wanted to. So let's get to the after pictures.
Okay.
Okay?
Wow. Very nice.
Upper and lower eyelids. Randy, some structural fat grafting in the nasolabial folds, marionette region, and a facelift to clean up the facelift to clean up the neck and jawline. And I think you can see that this patient, I think, is at least 10 years younger than this patient.
Doesn't even look like the same person.
It's amazing. I think that's what I want to hear from my patients. I want to hear that, her friends' comments to her were, you look outstanding, but we can't figure out what you did. Did you lose weight? Did you?
I mean, that's dramatic. It doesn't look done, though, but it looks...
This is a dramatic result, but this is what she got. These were the comments she got from her friends. And then she slowly, slowly gave in about having the procedure done. But this, I think, you tell me, what do you think is the difference here between before and after?
Well, I was thinking as I'm looking at this, it seems like that could be the daughter, or even definitely the younger sister. And I've told you this, in our green room, I could spot a facelift. We're here in California. Yeah. I could spot a facelift walking down the street. Yeah. And you said, and I'm paraphrasing you slightly, but you said, you can't notice mine. Yeah. And you're right. Yeah. I think everybody would agree with this. If you saw her walking down the street, you wouldn't think she had something done. Yeah. Right?
Absolutely. And part of that is not only a natural look, but the placement of the scars, how the incisions heal. The fact that you're not distorting the earlobes, which if you pull too much, you can cause what we call pixie ear deformity. So let's look at a job interview situation for this patient, Randy. I mean, which patient, as the person who's interviewing
for a job,
which patient is going to come across to you with more energy, more vigor, and want that job and want to perform to the best of their abilities?
Well, as you mentioned that, there's no doubt about it, the after looks more energetic.
Yep.
One of your lines, you call it looking younger and fresher.
Yep.
Right? And I think, is that what you've...
That's exactly what I'm trying to achieve. Now, there was something that we talked about earlier that you brought up that is a great point. This person has more wisdom and more knowledge that she's older. But the flip side of that and the cruelty of that is that without facial plastic surgery, she also shows that wisdom.
So the second half of life
Exactly.
should be, as you say, the best half.
Exactly. And it doesn't have to, it's not, we should be able to have increased wisdom, increased success, more money, but we should also be able to look good and feel good about ourselves. Why not?
So when everything's done, she's healed up, what do people like this say? What does a patient like this say?
A lot of times, Randy, patients know they look better, but they're not sure. Now, a lot of these patients have their own full studio of pictures of themselves over the last 10 years. I have to laugh. But what really comes to is when I take their before and after pictures and I bring them in. And I always bring them into my office, and it's just the patient and myself. And as you have seen, I'm very particular about the way I take my pictures. I want them.
Are they surprised when they look at the before and after?
I get a spectrum of emotions. I have had patients that just, all of a sudden you'll see a tear, just come out of their eyes. It's almost like a catharsis of emotion because the way they looked before was a reminder of things that they had gone through in their life. It's almost like they got a new lease on life. Today is the first day of the rest of my life.
Good for you. Now the profile shot, let's take a look at that.
Sure. This is our before, and then this is our after. And what you're seeing here, particularly in the lower one third of the face, you can see, notice how there's no jawline here.
On the before?
Yeah, it's just been washed out. And that's because of a descent of the soft tissues. What we've done is we've repositioned the soft tissues in a more superior position. That has two benefits, Randy. Not only does it clean up the jawline, but look at the patient's cheeks.
On the before and the after?
Yeah.
Yeah.
See how they're a little bit more fuller? But it's not exaggerated. The success behind a facelift like this is that this patient does not look operated on or altered. What we did is we took the tissues that have gone through a downward descent with aging, and we've repositioned them into a natural position without distorting or altering the patient. This patient's husband doesn't want to walk around with a woman that has these striations or this pulled look.
In California, we call it looking done. Do they call it there? Do women even say, I don't want to look done?
Yes.
That's the lingo?
Looking done comes up frequently, Randy. I seem to attract patients in my practice, Randy, that want a natural look. This is why they come to me. They've seen their friends, they've seen their relatives, they see the natural result, and this is what they want. So let's go on to this next patient, Randy, is a attractive woman, professional woman, extremely successful. She is starting to recognize when she looks in the mirror certain things that are bothering her. And once again, she is in a very competitive field. She's working with a lot of young, energetic people. When she looks in the mirror, she's concerned about the fullness in the upper eyelids, the fact that the brows have descended, and more importantly, as you look at the lower 1/3 of the face, she's concerned about the jawline and a little bit of the neck. Let's go to the after. If you look at her, that patient does not look...
She had a facelift?
She had a facelift.
Okay.
And an endoscopic brow lift on her. So I did a brow lift on her, and I also did a facelift. And we may have actually even trimmed a little bit of skin from her upper eyelids too, if I remember correctly. But once again, just the freshness that she has in the after picture, I think her face looks so much more youthful, energetic. She's ecstatic with her result. Now, look at her profile. When we're looking at a patient, their profile tells us a lot. When there's a large amount of skin here, that's a sign of aging. Look how clean her cervicomental angle is here and how we were able to rejuvenate her. Look how much more defined her eyelids, her jawline is, excuse me. Look at how I was able to give her a better brow position and also give her a better platform. This next patient was also another facelift patient, and once again, here you see her before. Now, what I want to show you here on this patient is relatively straightforward. With this particular patient, Randy, you could see that she has neck excess, a neck waddle, agreed?
Yeah.
And you can see the jowling, okay? But the thing I really want you to appreciate in this picture is that we've taken the pyramid of aging and we flipped it to the triangle of youth. So what do I mean by that?
Yeah.
And may I show you?
Yeah.
Can I have your pen there for a second? This is the pyramid of aging. So this is her before picture. And then afterwards, what we've done by repositioning her tissues, what do you notice? We now have the triangle of youth. Can you see that?
Yes, yes.
Look at how we were able to give her mid-face a more youthful posture and flip that triangle. These are the subtleties, Randy, that are really neat in my business.
I guess saying, do you consider yourself an artist is cliche, but is there more art than science to a great facelift?
Absolutely. I mean, the science is important to understand where the nerves are and the muscles and things like that, but the artistry is critical. And, with the last name like Greco, I think I might, I don't know. There's probably some genes over there over in Italy. Hopefully that one of my ancestors, kind of helped contribute to my
a lot of art,
a lot of art. Let me show you the same patient real quickly. I don't want to take too much of your time, but just look at the difference between these two patients. And look at how we were able to sculpt her neck and we were able
Very
to
nice.
sculpt her jawline. Look at this jawline here. Look how it's getting washed out and look at how clean that looks. Mm-hmm. Look at this neck here and now look at her cervicomental angle. Okay?
Very nice.
Now the other thing I want you to appreciate too, Randy, and you had mentioned this to me, take a look at the incisions around her ears. Do they jump out at you?
No.
Do they look like...
I only brought up that I couldn't see the incisions.
Do they look like something where it looks like someone is pulling on the reins of a horse?
Do you see these type of pulled facelifts when you're out and about? Because you're in the business?
Oh, yes.
You do?
Yes, I do. Yes, I do.
I know you want to be positive on the show. And by the way, we're running out of time. So, I know you have more men and females.
I'm just going to show you this.
Because we're running out of time.
This
is good stuff, by the way.
This particular gentleman, before, after, okay?
Wow.
All right. Now take a look at his neck and his jawline before and after. How many years younger do you think that patient looks?
Well, he looks at least 10 years younger.
But take a look at his profile, Randy. This is what I'm talking about. This establishment of the jawline is considered a youthful feature.
I mean, in a shirt and tie, that's a clean neck.
Yeah.
That's nice. Because, when I think of facelift for men, I'm sorry to impart my views here, but I don't like the idea. It seems like you're going to feminize somebody. But this guy doesn't look feminine.
No, not at all. When you talk about shirts and ties, with somebody with a neck waddle like that, they get bothered because when they put their tie on,
Was that right?
Everything bunches up and it bothers them.
So not everybody, though, gets a facelift.
No.
When we go to you. I've invited you to talk about facelifting. You do a lot of minimally invasive, non-invasive stuff. Is that right?
True.
Okay.
But I also do some other procedures that are a little bit more invasive. A lot of times patients will come for a facelift and they'll have a lot of deep lines around their mouth. And it's when the face has been repositioned and looks youthful, but then you've got these deep lines, there's such a dichotomy there, it's very noticeable. Now, take a look at this patient here, Randy. Now, this particular patient didn't want a facelift, but she was really, really bothered by the wrinkles around her mouth. I don't think you can see, take a look at that result. That result is striking.
Yeah.
Now, listen, you could say, well, Dr. Greco, why don't you...
What'd you do?
That was CO2 laser resurfacing.
Okay.
Now, you could say, why didn't you do injectables with her? Well, sure, I could have done injectables with her after 3 or 4 syringes and having her come back every 9 months. She pays for the procedure within 2 procedures of injectables. Okay, take a look at this patient here. Also, same sort of thing.
No facelift, just
No
lasers.
facelift. Just came to me. She was one of the typical patients, Randy, that we have in Philadelphia, which we call these the shore bunnies.
Shore bunnies.
They go down to the Jersey Shore, and every summer they put their baby oil on, and they expose their skin to a lot of sun damage.
Okay.
And they end up with these wrinkles. And then what we do for them, what I do for these particular patients is I will do a full face laser.
It's very nice. And these afters, by the way, are not touched up.
These are not touched up whatsoever.
Okay. Now, I know you brought photos with eyes, because you're known for the eyes. You spend half your time working with eyes.
Love doing eyes. It's the windows to the soul, and that's a cliche. But let's face it, and we talked about this earlier in this program, Randy. You have to look at somebody's eyes. If someone's not making eye contact with you, that gives you that kind of uneasy feeling.
You told me in the green room, eyes are the giveaway for how old you are.
Exactly.
Or show that you're older
exactly.
than you really are.
Exactly. And not only that, Randy, but the eyes are the first thing to really age on the face. So if you take a look at this patient, heaviness of skin on the upper eyelids, puffiness of the lower eyelids. What we did for her is we removed the skin meticulously without skeletonize her upper eyelids. And then the lower lids, we did removal of fat, did a little bit of fat grafting to take care of the tear trough.
So instead of fillers, you added her own fat right there.
That's correct.
Okay.
And then what I did is to top
Looks natural.
To top things off, I actually did a little bit of laser skin resurfacing just to get a little bit of tightening of the skin. So in one day, she comes in, Randy, and looks tired, and after her surgery, you could see the difference.
There you go.
It's relatively dramatic.
Now, I know, look, this is a big topic, and I know you have all of these videos. Okay, so you're asking for one more photo. Go ahead, one more. You love showing these.
Yeah, I do. You know why? Because it's just, I have so much pride in what I do.
Okay, good.
I want, when patients are so happy with what their result is, it's the only thing that makes me put my head on the pillow at the end of the night and makes me sleep.
All right.
When I know I've changed somebody and I've made them feel better about themselves, I could have a hot dog that night for dinner and I'm the happiest guy in the world. Probably having a beer and watching a baseball game like we've talked about before.
Okay.
Let me just show you this patient. Rhinoplasty is another huge part of my practice. This was a gentleman who came to me at age 16, got in, actually injured his nose, okay? And this is what he looked like, okay? This patient is older, and what's making him older is the hump that he has on his nose and this appearance that the tip is starting to drop, okay?
The tip, right, like a bird.
Exactly. This is this tiptosis, as we refer to it. This is his after picture. Look how much different that he looks, okay?
Yeah, very nice.
And then on his before and after pictures, this is his before picture. There's a deviation of the nose to one side, and then afterwards.
We are out of time. You look at aging, one of the things you said, as a chronic disease.
Yes.
That the aging face is a chronic disease.
Yes.
Elaborate.
Meaning that it's, I always equate aging face to someone who wants to go to the gym, Randy, and get themselves in shape. So what do? If they're overweight and they make a dedicated decision that I'm going to get myself in shape and I'm going to stay in shape, what do they have to do? They have to start working out and they have to keep working out. Aging face is the same way. If they get a facelift or any kind of procedure, in order to maintain that look, there are certain things that they're going to need to continue to do. These results aren't permanent.
Because you're big on skincare as well.
Exactly.
That's a big topic.
Exactly. So if someone can start with a surgical procedure as the foundation, and then,
once they're older, we should mention too. Because
Exactly.
you get younger patients too that don't need surgery.
Exactly.
Okay.
I mean, I usually say, Randy, when somebody comes in, if they're younger, I'm going to push them more towards skincare. If they're a little bit older, I'm going to push them towards injectables like fillers and Botox and things of that nature. And if they're much older, I'm not going to have them waste their money on the fillers because it's not going to have the impact. But that older patient that gets surgery, they may benefit from some injectables, you know, a year down the line after their procedure to keep them looking fresh and rested.
I guess the challenge with anybody, and I keep saying we're out of time, but we really are, is what it's going to look like. And you use imaging, like video imaging.
I do.
Or some type of imaging.
Yes.
Is it accurate?
It is accurate, Randy. And let me tell you something, it's extremely powerful. And the reason why it's extremely powerful is the patient gets the opportunity to see the procedure that they're looking for on their own face. And it's powerful. I think profilometry, showing the profile of the patient, if it's a rhinoplasty and there's a hump, if there's a neck and there's a waddle, if there's a jowl, if you can show these patients profiles and show them what their result looks like on them, it is very, very strong.
We are out of time, but you said, and I said I'll get it in there, you said you wanted your mission statement to make it in this program.
Sure. No.
And why is that so important to you, to get out?
You know, I think a mission statement speaks for why a person gets up in the morning and why they go into their office and do what they do.
It's your mission.
It's my mission.
Okay.
It's why.
And what is it?
It's why I go to work. And my mission statement is to provide meticulous, thoughtful, precise surgery that makes patients feel better about themselves and is provided with compassionate care. And that's what my staff and I deliver.
Good. Final message, a woman watching this or a man watching this, they don't like the way they're aging, but they're afraid of looking done or tight or pulled or whatever. What do you say to them?
Come on in and see me. I'll be happy to talk to you about what options you have, and I will recommend the most natural way that we can achieve what that person wants.
Good. I want to thank you for coming in. Excellent.
Thank you, Randy.
Excellent.
Thank
Great
you.
job. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.